Hello there, my name is Emma Jordan. I'm a physiotherapist working in Southampton with an interest in functional neurological disorder. Apologies that myself and my colleague Lou Baker aren't able to attend the session today, but this is a recording of our slides. What I'd say is if you've got any questions related to physiotherapy, still ask them at the end, and the team can feed back to us, and we can get in touch if needed. Thank you. So, I'm going to talk today about sort of the role of physiotherapy and functional movement disorders. So what are functional movement disorders? So it's an umbrella term, so it can be a wide range of physical symptoms, and you may well kind of relate to some of the symptoms listed here. So it might be weakness in the limbs, abnormal positioning, involuntary movements, and you might have problems with balance and with walking as well. And you might have other physical symptoms, such as dizziness or sensory changes can be a factor, or you might have visual symptoms. So there's lots of physical symptoms that can be experienced with FND, and you might also have some associated physical symptoms, so things that are almost secondary symptoms, such as fatigue, deconditioning if you've been less active because of your symptoms, and also pain can be a problem. And your symptoms might not be present all of the time, so with FND, symptoms can vary on a daily basis, weekly, monthly. Most likely they will be very variable, which can sometimes leave it feeling quite unpredictable. And I think just fair to say as well, not everybody will experience movement symptoms as part of FND. So this may not relate to everybody on the call today. So I'll talk a bit about the role of attention. So Tom's already touched on this. Attention plays a big part in functional movement disorders and how we are able to access our automatic movement patterns. And it's one of the sort of main key biological mechanisms that contribute to FND symptoms. But what is attention? What are we talking about? So I think putting it simply, it's where our thoughts and our awareness are focused. And sometimes it's nice to think of the brain's spotlight. So that kind of beam of light and the direction of sort of where that light is going. So it might focus in, the beam might focus in on a problematic symptom. And therapy would aim to kind of redirect the beam away. If that spotlight is focused on one area, the brain might dismiss other more relevant information coming in from the senses, from the environment. So it's important to redirect attention. And I think, just examples of attention in everyday life, it's quite relevant to all of us. When we focus on something, it can change the way we move or behave. Simple examples might be if you've been out in a party or something and you've been wearing high-heeled shoes and you're dancing all night, you're not thinking about your feet, you're enjoying what's going on, the music and everything, and then when the lights come on at the end, the music stops, and then you're suddenly really aware of your painful feet, and all of that focus then goes onto your feet, which you haven't really been aware of while you've been sort of enjoying your evening. So that role of attention can happen to any of us. An actor freezing on stage, for example, they know their lines so well, but if they suddenly start overthinking or thinking about what they're saying, it might change what's happened, and then they actually then fluff their lines and make say the wrong thing. Overthinking movement in sport. Footballers practicing goal shooting in their practice, they're probably getting every goal in, but as soon as you're in that situation of a penalty shootout, there's so much pressure, so much riding on it. Perhaps that little bit of fear or threat in the system, they're then overly focusing what their leg is doing, for example, then all that leads to them missing the goal, when actually, in practice they can do it, score a goal time after time. So there are sort of everyday examples of where attention can make movements or, how we move or behave, it can make things go wrong. So brain expectation, or brain prediction, you could call it, is another mechanism that contributes to FND symptoms. Along with this idea of attention, And there's also other interactions with the brain circuits, so the emotional processing part of the brain, and other areas where the interaction is changed in FND that can lead to some of these symptoms happening. So the brain, it has to process a huge amount of information from the senses, from the environment, to enable us as humans to interact with the world. And to be sort of super efficient and quick, the brain uses prediction. So it kind of makes a very quick decision based on what it thinks is the correct outcome, based on the information it's given, that huge amount of information. And this is based on learned experience, what we're expecting to see, what the brain is predicting is going to happen. And it's the basis of optical illusion. So like that example Tom used at the beginning with the different squares that appear to be different colour. And there's a resource pack we'll give you at the end of this presentation, which has got some quite fun and quite interesting examples of brain expectation on YouTube videos. So they're worth sort of having a look at. The brain can get it wrong. So the brain's making that snap decision on what it's expecting, but it can often get it wrong, and it can go wrong for any of us. So brain expectation or prediction going wrong is quite normal. A nice example, everyday example, is if you've unpacked your shopping and you put a big carton of orange juice in the fridge, it's going to be heavy to lift. You've gone away from that, you've done something else, you've come back for a drink of orange juice, not realising somebody else in your household has drunk most of the carton. So your brain's thinking it's full, your body's ready to lift a heavy item, and of course it's now light, and you completely overshoot the movement. And that's completely normal. That can happen to any of us. So, this happens in every day. If you've got 10 boxes in a row, 9 of them are full of bricks, 1 is full of feathers at the end, but you don't know that. They all look the same. So you're lifting the heavy boxes, your body's primed to lift heavy objects. The last box is light, and your body, your brain is predicting it to also be heavy. So you obviously, again, completely misjudge that movement, completely overshoot. Again, it's all related to that sort of brain prediction going wrong. So, in FND, over time, these, unhelpful movement patterns can become subconsciously programmed and learned by the brain. And the brain's making these prediction errors. So the wrong or the unhelpful movement program or pattern is selected. So the movement goes wrong and the symptoms worsen. And this can become a cycle. So movement goes wrong, more attention goes onto it, as we said in the previous slides about attention, overly focused on it, and then the movement goes more wrong. And it can then just be this sort of cycle. But things can be flexible. So the nervous system is a flexible thing, and these pictures just demonstrate that flexibility. Or you could call it neuroplasticity. So this is the brain's ability to change and adapt, for any of us. And this is the basis of learning a new skill. If any of us would learn to play violin, we would be learning and making new connections, new pathways, new movement patterns will be programmed into the brain, where to put our fingers for the, how to kind of play the instrument. So just looking here, this is kind of relating to, like, say, a familiar journey to work, journey to the shop, whatever. It's a familiar journey. That first picture shows a nice automatic, smooth sort of movement. You're chatting to someone, you're looking at your phone, you're on autopilot. There's no attention to what's happening at all. And then in picture 2, you've got this sort of blocked path. You can't get through your usual route, so you have to kind of reroute. So first of all, that's effortful. It's more cognitive. You have to think about what you're doing. You've lost that autopilot, that automatic sort of smooth movement, and there's increased attention to what's happening, which is all disrupting that kind of automatic flow. But you eventually find another route to work. So this, soon can become the new normal, and that's then smooth and efficient, and it's kind of learnt and automatic over time with that practice and repetition. And this can happen. This kind of flex and change can happen with both unhelpful movement patterns, where they can become learned and established with repetition, But it's also true for good and normal movement patterns. So actually, you know, these good and helpful movement patterns can be relearned over time with that repetition and practice and reinforcement of that helpful pattern. So activity. So sometimes I think the term activity can feel less daunting than the term exercise. But when we're looking at sort of becoming more active or retraining movement, we're looking at diverting attention, and we're using distraction techniques, as this plays quite a big part in the treatment of functional movement disorders. And there's some examples on the next slide. But again, diverting attention, or that redirection of the brain's spotlight, it helps us to sort of access those automatic and normal movement patterns. And it's more helpful to keep things quite functional. So what we mean by functional in this sense is things that you do in your everyday, like standing up from a chair, walking, washing in the shower, whatever it is. And there's some, in the resource pack again, there's some videos that, you know, certain movements like sit to stand, or, you know, standing, walking, reaching, things like that. There's some movement videos in the resource pack that you can look at for some treatment ideas. And it can be useful to try some self-correction. So it's not necessarily focusing in on the impairment, but looking at the movement overall. So perhaps watching yourself do it in a mirror, so it shifts your focus externally, so not into the problem and focusing the spotlight inwards. It's taking the spotlight and focus away from the body, and you're seeing an image of yourself. You can use external cueing, so things like treadmill to sort of set the pace, or using music or a beat, something that you know can cue your movement from externally. You can try video, like mirror. You can try a video of yourself, or get someone to video, again to sort of look at yourself moving from an external perspective, see if you can, you know, use some self-correction in there. And even things like, you know, sometimes with activity, some sort of generic movement like Tai Chi is a really nice way of accessing movement. So, and that's again watching a video, so you're following something on a screen, you're watching something externally. And Tai Chi is great for, you know, being quite non-specific. It's quite a gentle movement. You know, it's not focused on the impairment, and you can focus on sort of breath and relaxation elements at the time. So that's really, really nice in FND. But just keep it sort of non-specific exercise can be quite good. And I think also with activity, increasing activity levels can address deconditioning. So if you've been sort of fearful of movement, you know, if it causes pain, or you know, the movement goes wrong, or you feel subconscious, or whatever it may be, you might become less active. And actually, you know, it's important to try and keep your activity levels going. You know, try to improve activity levels to address things like deconditioning. And it's all about, you know, exploration. So you might notice that in some situations your movement is easier than others, you know, or some certain movements might be easier in certain conditions. You know, it's just maybe exploring that, testing a bit what's happened, you know, learn your triggers, you know, what are the environments or what's happening at a time when my movement's more difficult, and how can you maybe sort of change something or address that. And, you know, I think you also use sort of other people, family members, you know, to observe, you know, or when, you know, in this situation, you know, we see that you can move in this way, you know, ask other people as well. So just examples of distraction techniques. So these, you know, can be used sort of during the movement to enable you to try and tap into that more automatic and normal movement pattern. And different techniques work for different people, so it's really important to sort of explore different things and try and find what works for you. And I think it's so important to practice and persist with these techniques. And distraction can be hard, because I think by the very nature of trying to distract yourself from something, you're automatically refocusing on the problem. So it can, you know, it does take practice, and it does you know, need sort of persistence. So I think, you know, really don't sort of try a couple of things, think, oh, that doesn't work for me. You know, just really sort of try it. You know, give it some time. Because as we say, with that kind of learning, that neuroplasticity, you know, you need repetition and practice to make a change and to make you know, make a difference. So there's loads of things here, and it can be trial and error, as I say. So loads of sort of things listed there. But, you know, it can be things like focusing on another bodily process, like your breathing, focusing on the flow of air through the nose, or the rise and fall of the chest. Or you could focus on objects in the environment, describe it to yourself, imagine it in different colours and textures, just engage yourself in something in the environment, counting, panes of a window or ceiling tiles, whatever it is, different things like that engage and take your attention away from the body. Simple mental arithmetic, counting backwards in threes, or counting backwards in ones, whatever it is, 2 times table, whatever it is, just something that engages your brain and takes that focus away from the the problematic movements. And I think things, try different things, try different speeds or size of the movement, different rhythms, those, changing what's happening can be really helpful as well. And then, so just an example here. So this is an example of using distraction techniques in a graded approach, where you're kind of reducing distraction over time. And I think it's important to set an expectation of improvement. With FND, things can change and improve. And I think it's important to, sort of keep that in mind, and work towards goals. So small and achievable, really kind of tiny little steps, no steps too small really, but I think it just builds that sense of achievement with progress, and it gives that positive reinforcement that things are improving and changing. But this model, as you can see here, so let's say it's a person walking, their legs give way, so they use crutches. So initial treatment might be trying to do that normal walking, but with counting and sort of tapping a balloon or passing an object hand to hand, whatever it is. And then it might be that you reduce the distraction, so it's just the normal walking with counting. And then eventually you get to the point where you can just do the normal walking. And I think, it's quite a simplistic model, but I think, be prepared for setbacks along the way. This isn't always, it's not going to be day 1, day 2, day 3. This is going to be over time. And, changes will happen over time with that practice and repetition. You may take steps back along the way, progress, as Tom showed that diagram at the beginning, it might be very up and down, backward step, but, eventually, things will change in that trajectory of a general pattern of sort of improvement over time. And I think just to sort of summarise these sort of ideas, so it's all about sort of retraining the nervous system. Neuroplasticity, as we say, is that brain's ability to adapt and change and learn. And for any of us, playing the instrument like the violin, or learning a language, you don't learn it overnight. You learn it by practice and repetition. So your brain, learns, and that becomes the norm. And I think that saying, practice makes perfect. We all know that saying, but it's so relevant in this situation. The well-practiced movement patterns are the ones that are in the forefront of the brain. So they're easier for the brain to access and pull on when needed. So when it's sifting through all the information, it's making that really quick prediction. It's pulling on what's at the forefront of the brain, what it knows, And so, this can be the same as the helpful and unhelpful movement patterns. So, that if we're trying to sort of practice and retrain using the helpful movement patterns, those are the things in the forefront of the brain that, it can pull on when needed much more quickly. And the more unhelpful things move further to the back of the brain and harder for the brain to reach when it's doing its really quick, prediction. So lastly, just a little bit about equipment and aids, I suppose more around mobility aids, that kind of thing, or splints. But it's widely believed that unnecessary equipment should be avoided with FND. And I think it's more recommended to use those alternative techniques, such as the distraction, to help with movement difficulties. Incorporating the grounding, the breathing techniques, when you're practicing a movement. So all those things that help us to access the automatic and more normal movement patterns, rather than providing, aids and equipment. I think it can't be ruled out completely, because I think sometimes for safety reasons people might need equipment or a walking aid, but actually, see it as a stepping stone, as part of a goal towards, moving away from that over a set period of time. So maybe setting a goal around that piece of equipment, so it's sort of time limited and something that you're not relying on over time. Anyway, that's the end of the physiotherapy presentation. So my colleagues will now present their slides. Thank you.